for 2.5 minutes.
So again, back to Ms. Wilson, the president of the BC Association of Chiefs of Police. She quoted she said this at our last meeting, quote, "We know that diverted safe supply, diverted prescription medications are not what's killing people." And also when you consider the volume or the potential volume to scale up diverted prescriptions, diverted safe supply, it pales in comparison to what organized crime are doing in terms of fentanyl production, importation, and exportation. We know, maybe Ms. Schultz, you can talk about how easy it is to get toxic fentanyl on the streets of Canada and how hard it is and what the steps are to get a safer supply in the provinces that allow it. And I'm giving you time, and I apologize to the other witnesses, but I'm giving you the rest of my time, 1.5 minutes, because I know some politicians don't want you and other mums to be heard. I'm going to make sure you get that time to speak.
Thank you, Mr. John. We all know how easy it is to get any illicit drug anywhere in the country, and that drug dealers don't check ID. I had the example of young Olivia who died. In terms of safe supply, there are huge barriers for people who need this to save their lives. In British Columbia, where it is available, it takes a prescriber who is willing to work with the person, and only a small number of people, roughly about 5% of the people in British Columbia who could benefit on it, are on safe supply. In Alberta, thanks to a court injunction, we have one person left on safe supply who thankfully is doing well. She would be dead today. She said that to me. She would be dead today if it wasn't for the court injunction. So we throw huge barriers into people's way for a life-saving measure. Whereas it is easy to buy on the street and it is too often lethal. But we also ignore that people who die are not only those who need treatment, they're people who use occasionally. There are people who just use once, like young Olivia. These are the people we need to see as well, and that is where issues like drug checking are important. So we need to remove the barriers to save lives and implement evidence-based measures. Otherwise, the numbers in this country will continue to climb. And at the same time, start making treatment immediately available when somebody wanted. Work on prevention. But as nobody has talked about in prevention is poverty, the influence on poverty. You don't have prevention with just some education programs. You have to make sure that people have good lives.
Thank you, Ms. Schultz.